12:03. We are here once again. Dr. Payne Show. Dr. Lou is here. 1-855-55 Dr. Lou to get a hold of him outside of show hours or info at paincarecanada.com. We have a show chock full of business this week, my friend. We're going to get to a guest you have on the show today. We're going to focus mainly, or a lot of the show anyway, on concussion. So we'll get to that here in just a bit. Anything happening this week that or did happen this week that we should know about?
Yeah, well, we have a guest today, Dr. Adrian Rossi, who's an associate of mine that specializes in treatment of concussions with some very interesting techniques out there that are new and very kind of groundbreaking in terms of what's being done for the treatment of concussion. And I figured this would be a very important topic to talk about when you consider that, it's so prevalent in sport, and it's not just at the elite level that it's prevalent. It's also at the levels that most of the people that we would know, like the kids that we have, right, or the people that we know are playing in men's leagues, hockey, football. It could be very prevalent. I mean, it's also prevalent with things like car accidents. And I know we've heard in this past week that there's been more pedestrians hit in the last few months.
18 the other day.
Yeah, exactly.
And one fatality.
Yeah.
Crazy.
You obviously want to avoid the fatalities, but a lot of the people that are going to survive in any type of serious trauma might have a concussion base, and it's the long-term consequences of those concussions that could cause a lot of problems going forward. So there's proper ways to get those treated. And I thought that would be a very important topic for us to discuss, is how do you manage a concussion properly, and what is it that people should be doing? And more so than managing, there's even the talk around how do we implement certain things in order to minimize how often concussion. Like we know the NFL has done a lot right now to try to minimize the impact of concussion.
416-870-6400, star 640 on cell. Always inviting your calls, especially under this topic. I mean, it's bound to strike a chord of somebody, if not a lot of people who are listening. Got Adrian Rossi on the line. Hi, Adrian. How are you?
Good afternoon, John. Good afternoon, Dr. Lou. Thanks for having me.
Thanks for joining us. So there you go. He's here. So let's pick his brain. Not to be, pardon the pun, since we're talking about concussion, right?
Yeah, quite all right.
So we're going to, here's what we're going to do basically over the next little while. And again, we invite your calls if you have any questions or comments or something that's affecting you as well while listening to the show. We basically want to do like a top 5 symptoms, unusual or otherwise, when it comes to concussion, right? So how about you throw either you, Dr. Lou, or Adrian, you can throw one out there for us to start off. We'll expand on it. What do you think?
Well, you want to go for it, Dr. Rossi, or you want me to take it?
Well, at first I wanted to say, it's hard to say what are unusual signs of concussions because there are so many in between. Right. So maybe we should talk about more of the pertinent ones that people may think are not as obvious, but really they can be hallmarks of the condition.
Excellent. Okay, go for it. Give me one.
All right. Headaches and drowsiness. We have a lot of patients walking into the clinic like they just had 40 minutes of sleep for the whole night.
And this is consistent over a length of time?
Most prevalent in the beginning stages of it.
Talk about that, because most people, I mean, how many of us wake up in the morning like we feel like we haven't had enough sleep? We got a headache, but who knows, maybe we had a game of shinny the other night. We banged our head on the pavement.
To add to what Dr. Rossi's saying, one of the things when people are involved in some type of trauma, whether it's they just, got checked into the boards and they're unsure, the hardest thing is if you've never had headaches and all of a sudden you have a headache, it's easy to say, okay, maybe I'm suffering from a concussion. What's harder is the people who suffer from these types of things anyways, and then they start to continue to suffer and they don't know how to distinguish whether it was from a concussion or not. And headaches are a good example of that because of how prevalent they are regardless of it. And even drowsiness. Sometimes people just tend to say that they're tired all the time, but how do you distinguish being tired all the time versus a new type of tired, which is due to some type of concussion? And as Dr. Rossi said, these types of symptoms do tend to be more prevalent in the initial stages of the concussion. And then as time and rest play a role, they do start to minimize. But I think the important thing, and maybe Dr. Rossi can touch upon this, is for those existing people that do have these types of symptoms anyways, what's a big distinguishing factor?
Yeah, because my wife has chronic migraines, Dr. Rossi, so how's she going to tell the difference between one of her, here we go again, headaches and possibly a concussion headache?
Well, again, the biggest thing would be history. If it's something that she has experienced throughout her life and she notices changes when the weather's come on, when the weather changes, that's a little differentiating than someone who's in a football game and they wake up the next day because they thought that tackle wasn't as hard as they may have perceived it to be, but they're shaken up and they have a headache the next day and a little drowsy, not feeling right in the classroom per se.
If we back it up for a sec, Dr. Lou, just like concussion, basically, in layman's terms, isn't that really the brain smacking on the inside of your skull?
Yeah, the actual medical term for it is coup counter coup, and all that essentially is happening is your brain. There's a little bit of give between where your brain is and where the skull is, and what's happening in a concussion is the brain is going back and forth within the skull and making contact. So you're inducing some type of mild trauma to the brain in that instance, and that's exactly what it is. It's just movement of the brain within the skull.
It sounds like it could be really devastating. I mean, even with mild symptoms, I mean, that brain should not be rubbing up against the inside of your skull, right?
Absolutely not. It's definitely not something that should be happening, and that's why as a society, we've started to get better in trying to recognize when these things are happening, because what ends up happening, and it's kind of like any injury, is that once you've sustained a concussion once, you're more prevalent and more likely to sustain a concussion again. And not only do you sustain it again, but those symptoms that you have tend to get worse and worse and worse. And, I've treated elite athletes who have had repeated concussions, ignored it, or not necessarily ignored it, but continued to go through with their sport. And, I've even had one case where the person ended up suffering a brain hemorrhage. And so that was kind of the end stage. Luckily, everything was okay. But that's how serious these things can get, that once there's trauma induced to the brain and it's repetitive over and over again, there can be some very serious consequences. Also, when you look at, I don't know how many of our listeners have watched the movie Concussion with Will Smith and about, the head trauma related to football and other different sports, but what they're finding with the chronic traumatic encephalopathy, which is something they talk about in that movie and is documented now, that the brain actually changes and can make people do very, very strange things that they're not even aware of.
Behavioral changes.
Wow. And that's one of those symptoms that could be very weird. Like irritability could be a symptom of a concussion. All of a sudden, for no reason, you start being moody. People say you're angrier. These are things that may indicate that there's been some type of trauma going on in the brain.
I mean, it's ended careers. I think, maybe even Brett Lindros that ended his career. Multiple concussions, couldn't play hockey anymore, right?
Yeah.
That's right.
I think one of the things, too, is you almost have to give credit to some of these people who realize what they've undergone and end their careers. I think it also takes a certain type of person to say, you know what, I know that I've had this. It's going to be prevalent going forward. Maybe it's time I stop, because now you start to border on, something that you do for a job potentially affecting your life.
Right.
And the lives of others around you. Because, there's been instances where people who have undergone that chronic traumatic encephalopathy have ended up killing their wives, their kids. There's examples of this in professional wrestlers. Chris Benoit was an example of this, where he suffered this type of stuff, and brutal killings of his wife and his kids. So it needs to be something that is taken very seriously. One of the interesting things why I invited Dr. Rossi to the show was he does a lot of therapy with light and lasers, and I'll let him talk about it, on how he actually treats these things and gets the brain better. So, Dr. Rossi, if you want to...
Stick around. Dr. Rossi will get you. Again, your phone call is 416-870-6400, star 640 on cell. This topic has piqued your interest. We're talking about concussions. They're all over the place. Give us a call, and Dr. Lou and Dr. Rossi will be taking your calls as they come in here on the Dr. Payne Show, Talk Radio, AM 640. 12:15, your calls. Bring them on in. We got open phone lines here. Dr. and Adrian Rossi's here. Of course, Dr. Lou taking your calls, and we're talking about discussion for this hour anyway, basically on concussion, because we just talked about it off the air. It's not only pro sports, elite sports, it's also the kids who are out there right now on a Saturday morning with their moms and their dads, and they're banging their heads off the ice. It might not be physical contact, but it's contact of another nature, right? How does that affect them?
Yeah, and just to add to that point, it's not even just those structured sports. It could be them at recess. Right?
Sure.
They're playing around with their friends. They're doing things. And again, if the brain is moving within the skull, you're creating some type of concussion base. What I want to get to, especially since we have Dr. Rossi here right now, is he's done a lot of stuff towards using light and laser therapy through the eyes in order to make a change in the brain, in order to help these people that suffer from concussion. So he's had all the way from, like you said, 5-6-year-old kids who are just playing shinny, all the way to elite athletes, to people with stroke, any type of neurological thing, where he's been able to use this type of intervention to have an effect. So I'll let Dr. Rossi talk.
How does that work, Dr. Rossi?
It's fascinating, and I first sparked my interest when Sidney Crosby was first sidelined a few years ago. And there was a chiropractor from the States that was developing some methodologies and based it on a study that came out where a swim coach was noticing that his athletes, when swimming from point A to point B of the pool, they were going faster than when they would swim from point B to point A. And he realized that what was happening was when his athletes would go from one end of the pool to the other, and the photographers would take pictures, the lights would go off and excite their brain and actually stimulate their cells in their nervous system and the muscular systems to produce faster, quicker movements. Conversely, when going from the opposite way, it would inhibit their movements and it was slowing them down. So he thought that there was something to the lights going off and stimulating his athletes that may give his team a little bit of an advantage. So there's more to those blacked out swim goggles than just fashion when it comes to the Olympics and elite athletes.
So if we hung a disco ball above Usain Bolt, might be able to shave a couple hundred thou off his time. We don't know. Yeah. So how are you using that for therapy?
It's fantastic. So there are certain reflexes that exist within the brain that we can access through eye movements. And that's with our patient actually performing active eye movements and from myself stimulating different regions of their brain where they put on this device, which is as simple as glasses that flash lights onto different parts or quadrants of their brain to stimulate areas that I've decided after my assessment with them need stimulation, will help them get there from where they are today to where they need to be.
And this is for concussion based too.
This is really, I found the best results are for concussion, but any type of neurological issue. I mean, it's easy for me to put my hands on your shoulder or the knees or the ankles, but I can't access your brain. And we have found a way to essentially hack into it through the eyes to essentially give the therapies that we need without any medication at this point.
Yeah. If I can add something there, one of the things, and we've repeatedly talked about it on the show, is the importance of rehabilitation for injuries. Right. And what Dr. Rossi is explaining here is the importance of rehabilitation of the brain. How do you rehab the brain? But the harder thing, like he suggested, is it's very easy for a practitioner to grab your knee, move it around, or for a surgeon to go in and repair that meniscus. But it's much harder to rehabilitate the brain. So you have to look for points of access to the brain. And one of the high neurological points of access to the brain is the eyes, and using lasers, lights in different quadrants based on a proper assessment. I mean, this isn't something that anybody could just do. There needs to be special training. And I know with Dr. Rossi, one of the things that he also does is not only is he doing this therapy in clinic with these patients, but he's teaching them what they need to be doing at home and what types of exercises to stimulate their brain is going to really be beneficial towards them healing in that concussion.
Dr. Rossi, we mentioned some headache symptoms, some dizziness. What else can you expect, or what else should you be looking for if you're not familiar with a concussion, if it's happening to you?
Irritability would be one of the biggest things. Frustration, irritability, sensitivity to bright lights. Like Dr. Nally had touched on before, Dr. Lou rather, anything out of the person's norm or outside the norm of their personality changes. That's a big red flag.
You know, we were talking about this again while we were in a short break, though, Dr. Lou and I. And for years, it's always been, that personality change, the aggression. We've always called it, quote unquote, roid rage. And, Dr. Lou says possibly maybe you're thinking about it from the wrong end. Maybe it's not the steroids. Maybe it's a symptom of concussion. Yeah. Yeah.
Well, I know growing up, especially, I was very into like the pro wrestling, the WWE stuff, as I know Dr. Rossi was, because we've had many discussions on this. And, we always assumed in those earlier years of this type of discussion that these people had rage and they were doing all these crazy things and it was roid rage. And there may be a point where that's true. But I think what's fascinating is now that we're starting to learn that chronic traumatic encephalopathy and the types of changes it can have, it's very analogous to that roid rage. So how are we able now to look at this and say, is it really the steroid use that's doing this to people? Or could it be more that head trauma that's causing this type of change in these people? And this also goes for kids, for example, who are bullied and beat up, right? And there may be changes that happen over their life that get them to a certain point that cause them to have these personality flaws or behavioral changes. And so that's really the importance here of understanding is one of the things that I try to talk about, and I'm sure Dr. Rossi will agree on this for concussion and neurological screens, is if you have young kids out there, it's worthwhile to come see myself or Dr. Rossi to get baseline screening.
Or anybody who's trained to do that type of testing, really.
Right.
Yeah. So we need to understand where is that person now. That way we can gauge if changes are happening later on.
Phone calls, 416-870-6400, star 640 on cell. Lines are wide open, and write this number down as well, even when the show is over, 1-855-55 Dr. Lou. That'll put you in touch with Dr. Lou. Dr. Rossi hanging around as well. We got more of the Dr. Payne Show coming right up Talk Radio, AM 640. It is 12:24. Dr. Payne Show. Dr. Lou is here. Dr. Rossi as well joining us for this hour. 1-855 Dr. Lou. You need to get a hold of Dr. Lou outside of the show. We're info@paincarecanada.com. Got issues, go see him for sure. We were talking before the show started. I think I have what's called golfer's elbow. I'll tell you what's really called a pain in the ass. It can't work out. Plain and simple. So you said, pain in the elbow. That's right. Well, it's moving
Wrong
down.
Anatomical spot, John.
That's right.
Maybe you just don't know your elbow from your ass.
Hey now. What are you, my dad? So you're talking, best thing, and people hate to hear this, you need rest. People don't like rest. It's an interruption in their lives. They feel like they're getting old. Speak to that, Dr. Rossi, about when it comes to concussions and that type of trauma, how important rest is.
It's paramount in the initial stages. Our brain needs the rehab as much as it needs the rest in the initial stages. And there's simple things that we can do. And that's putting our cell phones down, shutting off our iPads, turning our computers off, less light stimulation. These little things, listening to music on low volume, if not at all, resting in a quiet, dark spot. Our brain really needs time in the initial stages to recover from the trauma that's induced.
That's so key. I mean, my daughter is 8 and she is plugged into stuff like that. You try to get her out doing sports and other things, but kids are just in their car. You plug in your car, it comes up on your screen, your phone's instantly connected.
Yeah. If I can add something to Dr. Rossi's point about how important. See, the thing about rest is one of the things we need to distinguish is when we say the word rest, we need to define rest for the individual, because people think rest means don't do anything and just stay at home, blah, blah, blah. And that's what scares people, because it seems like it's an all or none concept.
Right.
What Dr. Rossi alluded to there is that rest is a relative term. So rest in that individual's case may be, if they're also a student along with a hockey player and they're spending 10 hours in front of their computer, maybe rest is not necessarily no computer time, but maybe 2 hours of computer time followed by a 2-hour break. And that's where the individual assessment comes very much into play, is determining what are the right amounts of rest. I know one of the interesting things too, when we look at what computers, cell phones, anything that has this light stimulus and what it does to us. We often talk about, and we have patients as well, myself and Dr. Rossi, who have sleep disturbances. One of the quick recommendations that we make is put that thing down, an hour before bed, because it is stimulating the same way that he talked about with the photographers, stimulating these people's brains. When you have those things in front of you before you're trying to get restful sleep, it's creating a level of stimulation that you probably don't need at that point.
That's right.
So rest can also mean which period of the day should you not be doing these things. And I'll let Dr. Rossi add a little bit more to that.
Go ahead, Dr. Rossi.
Absolutely. Talking with students, for example, there is a specific return to school protocol. It's really difficult for a student who hadn't had time the night before to study for a test due to concussion to then immerse himself or herself into a classroom with bright lights and loud noise and this big test in front of him. And it's really imperative that they do get a little bit of rest, or in that case, we allow for different recommendations and a lot for the teacher to give them more time, have them in a different room from the classroom where there's not a lot of outside disturbances and they can focus on the test. And to just build on Dr. Lou's point from before, and if it's imperative that you need to be on the cell phone or in front of the computer, something as simple as looking at the screen from an angle gives a little less intensity than looking at the screen directly. So there are these little nuances that we can implement.
Yeah. 416-870-6400, star 640 on cell. You got any of these symptoms? You think you might have a friend or somebody in sports or otherwise has been having concussion problems? We're discussing it this hour. Feel free to give us a call. So we've gone through a couple of points. Dr. Rossi, what are some other signs of concussion, either obvious or otherwise?
I think one hallmarks, and I wanted to bring this to a point, is only 4% of concussion patients suffer a loss of consciousness. So it's really important for our listeners out there to understand that just because you didn't black out doesn't mean you're not concussed.
Right.
And and again, just building on to that is the confusion that will stem about because of that. And that's why you're asking your athletes right away, what day is it? What's the score? What half are we in? We want to make sure that there are no initial disturbances.
I think that's an awesome point that Dr. Rossi just brought up. And again, it takes me back to my perspective on healthcare should be individually assessed and is very relative, because he's very right. Most people assume that if they didn't black out, they didn't lose consciousness, that they therefore do not have a concussion. And I guess the discrepancy is in the word concussion is in loss of consciousness. So people assume that it means the same thing. But as Dr. Rossi alluded to, it's very different. Concussion is a syndrome. It's a constellation of different symptoms, which may or may not include loss of consciousness and or other things like irritability. And this is where the importance of, if you have had some type of head trauma, most people will know if they've had an impact that has affected, whether it's a slip and fall, just the whiplash component of a car accident, or you're playing outside and you go down hard with you playing with your brother, your sister. There's a concussion component that may have occurred and may not necessarily cause these big, loud symptoms that we would expect. And so the proper assessment of what I was trying to get to before about baseline testing, what are the neurological capacities that the individual has at this point in time, and comparing it to at a later time if that happens.
We'll continue that discussion. 416-870-6400, star 640 on cell. Dr. Payne Show continues. It's right here, Talk Radio, AM 640. 12:33, Dr. Payne Show. Dr. Lewis here, of course, and Dr. Adrian Rossi joining us for the hour, talking about everything under the umbrella of concussion. So your phone calls as well, 416-870-6400, star 640 on cell. Would love to hear from you. Got about a half hour to call in and voice your opinion or your concerns. We started talking about this during the break, and we'll tread lightly around this one because we don't want anybody to not use them, but we started to talk about the conversation of helmets as a concern to sport, and also something as simple as riding a motorcycle.
Yeah, or bikes for that matter.
Or bikes. So what do you think about that?
And obviously they're very important. And again, we're not suggesting that anyone doesn't wear these, but when we look at the conversation around concussion, I think that helmets do a lot to protect from outside in. So preventing the fracture of a skull is going to be a role that it plays. Can it really have an effect from the inside out, where it stops that movement of the brain to hit the skull, that coop counter coop? That's, I would say, based on my perspective, may be a little bit more arguable. So people think, oh, well, if I'm wearing a helmet, and again, I think I'm not advocating to not wear a helmet. I'm advocating for wearing a helmet, but understanding that wearing this helmet is probably protecting you more from a fracture than it is from a concussion. So you shouldn't automatically assume that, if you're playing shinny with your buddies and you fall and you hit your helmet, that, well, I didn't suffer a concussion because I was wearing a helmet. No, you may have still suffered a concussion. It's just the helmet probably did a lot to prevent a fracture or worsening symptoms. Because
I've said this when this whole thing, in the last several years anyway, especially when it comes to NFL ball, and they're talking about helmets and making the helmets better. Even then, I thought it's the rapid deceleration of the brain smacking against the sky. Helmet's not going to stop that. Right? It's
unless, I don't know the exact technology that they're using in things like the NFL helmets. What I am confident to say is like the point that I just made, is that for sure it's going to protect you from the very serious things like fractures and things like that, which, could very well be life-threatening. But what I really want to get across to the listeners is, don't assume that if you or your kids or someone that is just wearing a helmet, that's preventing them from concussion. That can still lead to concussion. And the discussion here is recognizing those symptoms that may exist around concussion and getting them assessed early on, and then going about the proper treatment and rehabilitation of that specific symptom so that you don't get worsening effects as you go on. Because the last thing you want to do for a kid who's playing hockey is have them stop playing hockey. I think it's good that kids are active, but we could do a better job as a society and as individuals that have kids to call the responsibility on ourselves to make sure that we're getting these kids looked at, tested for baseline, and then implementing the proper treatment if necessary.
Dr. Rossi, what do you think?
I think it's so important because we oftentimes are not really we don't have light shed onto the long-term effects of concussion until later on in the athlete's life or the individual's life. So I think having a baseline to refer to, and the earlier, the better.
What's your suggestion? And we were talking to Anthony here in studio a few minutes ago. A guy, typical guy, he's out on the weekend, he's playing shinny or some lower league hockey with buddies, takes a flip, bangs his head on the ice. He's like, okay, gets up, but he's got to go to work on Monday. Maybe he's got a headache. Maybe he's feeling some symptoms, but he's got to go to work. Does he take a week off? Does he get rest? Does he get treatment? What's the suggestion?
I mean, the biggest thing is we want to first identify if it's an emergency scenario. Is he unconscious? Did he vomit after the initial impact? Or is this something that kind of precipitated throughout the night, and the next day he is feeling the symptoms. Any prudent practitioner is going to recommend that person be assessed because they're not the expert in that field, and sometimes we can't shake that off. And God forbid that person doesn't wake up the next day. We want to make sure to stabilize whatever injury would be there, would be that serious or not. So on whatever scale that may be, especially with the head, you definitely want to have that checked out by the appropriate specialist.
416-870-6400 star 640. And so, well, you mentioned vomiting there. What other signs can we look for, like I said, otherwise, obvious or not obvious about concussion?
Sometimes seizures tend to rear their nasty heads. You'll have uncontrollable arm and leg jerking. Some people may complain of numbness and weakness in their limbs. Oftentimes that may also be indicative of a fracture in the higher parts of the spine, be that where they're experiencing that.
One of the things that I'd love to hear is I'm sure we have listeners out there who, may have had something that they thought was a concussion. They're not sure. We'd love to hear the types of symptoms that people have had after, even minor head traumas or things that have happened in their lives, whether it was sport related, car accident related, a slip and fall. I think it would be good to kind of get the prompted questions and look at what some of these, because I think the way to identify weird symptoms is to really have the people who have suffered them call us. Because for Dr. Rossi and myself, we look at this, and although we're calling them unusual, they're not unusual to us because they're neurological symptoms. Everything that he's mentioning, if something happens in the brain, it can lead to different types of neurological types of symptoms, and the brain has an effect on everything. So therefore, to him and I, nothing is really unusual, but it may be more unusual to people who aren't educated in this type of stuff.
So that's you, 416-870-6400 star 640 on cell. This may seem obvious, but is it a big factor? Forgetfulness, slurred speech, not remembering things, is that all part of it as well?
Yeah, and again, the point that Dr. Rossi was alluding to is one of the things with concussion, and like most, we'll call them musculoskeletal injuries, is you really want to make sure that there's nothing more serious going on. And concussion is one of those things that once you've eliminated hemorrhage, stroke, any more serious neurological condition, you're confident to say, okay, these symptoms exist because of concussion, because something like slurred speech can also be a symptom of a stroke. And so we don't want anybody out there thinking, I have slurred speech, it's probably just a concussion. Well, no, it could be a stroke. If it's not a stroke happening and there's nothing around that, then maybe the last thing that it is a concussion.
That's right.
We'll take a quick break. Your phone calls, 416-870-6400 star 640 on cell. Lots more of the Dr. Payne Show coming right up. It's right here on Talk Radio, AM 640. Dr. Lou here, of course, and your phone calls. We invite them. And Dr. Rossi is here for the remainder of the hour and has been. Got Ken. Welcome to the show, Ken. How are you?
Doing well.
Good. You got a question or opinion for Dr. Rossi or Dr. Lou? Go ahead.
I'm doing well. My daughter isn't. I have a 28-year-old daughter who just over 3 years ago was kneed in the head, actually in the temple, by a horse and gained a concussion.
Okay.
She has had MRIs done. They come back normal. She has been to numerous specialists, you name it, she's been to, plus family doctors, and no matter what has gone on, the headaches are still are occurring.
Ken, has she done, besides any of that stuff, has she done any of, we spoke earlier in some of the earlier segments this hour about the light therapy and different types of interventions using the eyes. Has she done anything like that to potentially help her out?
She went to a neuro-ophthalmologist who got her to do all sorts of eye exercises, yes.
Okay. Do we still have Dr. Rossi here?
Yeah, I'm here.
Yeah. Dr. Rossi, do you have any opinions around this?
Has she tried anything with light stimulation through the eyes?
No, she has not. I know she has not done that.
Okay. Yeah,
so there's a tool in our toolbox that we haven't explored.
Yeah, I think the point that Dr. Ross is trying to make here, Ken, and we try to make this often, is you kind of, as a practitioner for us, one of the things we do is look for what's the missing piece, because potentially that missing piece might be the key to the treatment component. And like Dr. Rossi alluded to there, that's probably the component that's been missing with your daughter. And I would say at this point, it's worth a shot. I see that you're out in Hamilton. I mean, booking an appointment with Dr. Rossi is probably not a bad idea. It's a very quick assessment. and he can figure out a lot of things that maybe haven't been figured out to this point. And a lot of the recommendations are probably things that she could be doing at home and doesn't necessarily have to go for repeated treatments. And I don't know if you want to add anything to that, Dr. Rossi.
Dr. Lou, you nailed it.
He often does.
Yeah, that's my job.
He often does. Ken, I'll give you a number to start with anyway, 1-855-55-Dr. and info@paincarecanada.com. We'll take a quick break here. Lots more coming up on the show. Actually, you know what? No, we'll not take a break. We're going to talk a little more about this. So other than that, I mean, what other things can we look at, Dr. Rossi, as far as concussions concerned? Symptoms-wise.
Symptoms-wise. All right. Well, I mean, we discussed about the seizures rearing their head. Sometimes individuals can't recognize people or places. I actually had a story of a patient that forgot how to put on their socks.
Come on.
We needed to reintroduce that to their brain and reestablish that connection. And really the wonderful thing about the brain is it has the ability to reestablish this connection. So if one root is down, it'll establish it in another way, and you're able to then have that ability that you'd lost.
And to add to his point, and now that he's talking about it, I do remember once having a patient that we were assessing, and the only thing that was strange that suggested there might be a concussion once we started going into it was they were talking to me because their penmanship had changed. So that they found that when they were writing, sometimes they were unable to lift their hand off the paper and not properly go to the next letter. And that was kind of cool. And that's where we started the process and determined, that this person had actually had a concussion. And that's the part of the brain that it was affected. Again, for us, for Dr. Rossi and I, this is all kind of normal because these are symptoms. The brain controls everything. And so if there's an insult to that brain, then it could potentially have an effect on anything that the brain controls, which could be anything.
I wanted to mention that, it's, I mean, you just had to step outside today and, it's not too far till we're getting into the cold weather and the snow weather.
Yep.
The car accidents will happen. There's going to be injuries. There's going to be concussions. And if you listen to 640 for some time now, the Insurance and Injury Law Show with Sivan Tumarkins here tomorrow. Now, you're going to be on the show tomorrow with Sivan.
Yes.
And then next Saturday on this show, right, this time Sivan will be on with you guys. So kind of the interplay between what he does and what you guys do.
Yeah, and one of the things, Sivan and I speaking, one of the things that I talk about even to my patients when they're involved in something like a disability claim or a car accident, a good personal injury lawyer is part of your healthcare team now because that's going to be their job to make sure that whoever is supposed to be paying for your care pays for your care. So that's some of the things that we talk about tomorrow on his show. And then next week we'll be live, obviously, as we are here with Sivan, and we'll likely deal with all things related to car accidents specifically. And we're going to encourage people to call, whether it's a car accident due to an injury question that they have for me or maybe a legal question that they have for Sivan. But yeah, we're trying to do looking at everything from a holistic, all-encompassing perspective.
Have you guys ever found in any of your practice, I mean, the severity of the concussion notwithstanding, is there any gender, age group type of person that comes back better from a concussion than others?
I'll let Dr. Rossi answer that because he is in our team. He's usually the one that treats these types of things, so he might have a better...
What do you think, Dr. Rossi?
That's a great question. For me, it's been a 50-50 split. Right. The biggest thing here is we've seen that the majority of these concussions will resolve within a 2-week period. About 80 to 90% will resolve within a 2-week period. Once treatment starts, maybe not resolve 100%, but we'll get you well on your way, is what we're noticing with this. Recovery time, though, we should note, we have found to be a little bit protracted in children and young teens just because of the development of the brain.
Yeah, and one of the things, I mean, from any natural healthcare perspective, anything prognosis, which is how likely someone is to get better, depends on a lot of things that stay consistent. So obviously, and we hear about this like with the flu. Who should be getting flu shots? The very young and the very old. So likely those types of people may have some type of decreased prognosis and getting better from a concussion. I also think that level of fitness, the same as when we see somebody who hurts their shoulder, one of the things we look at is how fit is this person in terms of cardiovascular fitness. Like athletes we find tend to get better quicker than someone who's the weekend warrior because they just tend to be a little bit unhealthier. And so I would say that probably, and Dr. Rossi probably agrees, that a lot of those common characteristics of prognosis that are so important end up being important in concussion management as well.
I'm actually So you guys are either really good or I'm just shocked that 2 weeks seems really quick to get somebody back in track that quickly with a lot of, that percentage of getting fit again. 2 weeks seems really quick.
Yeah, Dr. Rossi, you want to touch on that?
It was a study that had come out in 2008. It was the Third International Conference on Concussion. It was held in Zurich. And it was a conclusion that they had come to, and the panel quoted from some literature. They unanimously retained the concept that the majority of concussions do resolve within a short period. What we want to focus on, too, here is that 20% where after 7 days, 10 days, they haven't shaken it off, and they can come in and we can get them well on their way. Like Dr. Payne had said before, it's very patient-specific. Your athletes are going to respond better than your non-athletes, and your children and adolescents will take a protracted time to recovery because of the development of their brain.
416-870-6400, star 640 on cell. You still got some time to call in with any issues. You have questions about concussion. They'll get them answered right here, right up until 1 o'clock. The Dr. Payne Show, Talk Radio, AM 640. It is 12:53. Last few minutes here of the show. Phone calls, 416-870-6400, star 640 on cell. Steve, hi.
How you doing?
Good, Steve. What's your concern?
My question is misdiagnosis of actually concussions. I'm involved with pretty high level of hockey, and you see a lot of concussions happening within the hockey players themselves. But I'm finding lately, and I'm not sure if you're seeing this, where it tends to be a neck injury more than it being a concussion, and it takes some time to actually figure this out, depending on what doctor you go to.
Yeah.
Have you found that in your practice with some of the injuries that come your way?
Absolutely. And I think the most important thing, and maybe Dr. Rossi touches on this too, is when you're getting assessed and someone says that they've had a head trauma, well, the head has to be attached to something. And likely if the head sustained some type of trauma, probably the neck, the upper back, the shoulders probably sustained some type of trauma. That's where treatment needs to be focused. This is my big thing. Treatment is focused towards the root cause of the person's problem. So, and I know Dr. Rossi does this a lot when he's treating his concussion patients. He's also usually treating their necks. Also because of when you consider that the brain stem, which controls a lot of different things, is in that area, treating the neck can have an effect on that brain stem, which also has an effect on treating the concussion. So yeah, absolutely. When you're looking at a concussion, I would say there's a lot of different areas that could have gotten hurt as well besides just the brain, but definitely the neck is going to be an area that needs to be looked at. And I know that, like I said, Dr. Rossi and the team that he has treating this stuff, they definitely look at that whole musculoskeletal component as well.
What do you think, Dr. Rossi? Want to expand on that?
I think it's absolutely important. You have to look at all the segments that are associated with the area of complaint, and it's sad if it ever goes missed. The biggest thing that we have to learn is that our patients that come through the door are not textbook, examination examples. They're allowed to have more than one thing wrong with them, and we need to be aware of that and be astute to observe and detect it and attack it at the appropriate stages.
Yeah.
Steve, you need any more information anytime, 1-855-55. Dr. Lou would be the number. Got Christina here on the line. Christina, how are you?
Hi, I'm all right. How are you?
I'm good.
Great. I called because I was in a car accident about 5 weeks ago.
Okay.
And I was diagnosed with whiplash and concussion. Now, they said small concussion at first, but I have all those symptoms of memory problems, headache, light sensitivity.
Okay.
And I'm being treated for the whiplash in this last few weeks. And I'm on tap to see a concussion specialist. But I guess my question is, how is the best way to keep proceeding with looking for medical treatment?
Dr. Rossi, do you want to take this?
I was going to say that the best course of action to take is what your medical physician has recommended to you to do so far, and it sounds like you're being directed down the right avenues. Do you know when the appointment with your concussion specialist would be?
No, that's not. That's process right now, I guess.
So kind of to be determined.
Yeah.
If I could add one thing that I often encourage this even of my own patients, is the second opinion is never a bad idea, and that's from someone else. So, I'm sure that you're getting all the appropriate care, and that's great, but, seeing someone like Dr. Rossi as well to get his assessment, his opinion, is not a bad idea. And even if his recommendation gets taken back to the team that you're currently using, at least you're going to get the appropriate care. And again, this is something I even encourage of my patients, where I'll say, go get that second opinion, because, and I'm sure Dr. Rossi agrees, no one person knows everything. And we can all make mistakes and miss things.
It was something I was alluding to when I asked when the appointment would be. Because us here at Pain Care Canada, we're happy to expedite that process. And, we can see you. If you give us that call, we could see you within that 48 hours, 72 hours. So if it's something that's really frustrating you, and I can kind of sense that with the way your voice is coming through the phone, we'd be happy to see you in the clinic even before you go to that concussion appointment. And we're not saying that you shouldn't go. We're just saying that you may be able to do something you think.
Yeah. Christina, appreciate the call again. 1-855-55-Dr. Lou and info@paincarecanada.com. Come see the guys for sure. You got about a minute. There you go. Wrap it up for the week.
Yeah, I guess that's the biggest thing. And that last point that Dr. Rossi was alluding to and that I alluded to goes for all things related to pain management. That second opinion from us, even if you're listening out there, you're getting treatment from someone else for something, whether it's a knee issue, a shoulder issue, a low back issue, you're not happy with the results. We are very, very happy to assess you and determine either, yes, everything's being done correctly, follow through. It's just that reassurance a lot of the times that helps patients, that says, okay, yeah, I'm happy that what's being done is appropriate. Right. And then a lot of times we do end up finding, something is being missed. And when something is being missed, we can add that into the treatment perspective. And again, the Pain Care Network that we have, we work all encompassing in that we want to work with people's current healthcare teams as well. We're not right. trying to take patients from other clinics. What we're trying to do is make sure that people get the right treatment, and the right treatment goes through communication. And I've had plenty of people since I've started this venture come in where I provide a recommendation back to their current providers, and they just follow through with that, and the outcomes are much better. And I think even the providers out there welcome that, and I welcome it for my patients as well too.
You'll be back tomorrow on the Insurance and Injury Law Show at noon with Savan. In the meantime, 1-855-55-Dr. Lou and info@paincarecanada.com. Thank you, Dr. Rossi, for joining us. We'll get you back on the show as well, and we will